Good afternoon. How are we doing? Good. Good, good. All right. Just want to say welcome back. Thank you for being with our triad today. Everybody, this is Val Guzman. Today's topic, we're going to be talking about Medicare updates. Thank you.
Okay. All right. Yeah, thank you for having me again. I know I recognized some of you from last year. So my name is Val Guzman. I'm with an agency called AgeGuide. Just to have a quick the overview of who we are. So AgeGuide is, we're considered the area agency on aging for Northeastern Illinois. And so the big thing that we do is we help provide various services to older adults and people with disabilities. Things like transportation services, caregiver programs, the Meals on Wheels program that you might be familiar with. And more directly, what I work with, I'm part of a program called the Senior Health Insurance Program. So this is it's a federally funded program where really our main goal is just to be a resource for you about Medicare, Medicaid, but we're not an insurance company. We're not affiliated with any insurance companies. So we're actually not allowed to tell you what to sign up for, or we're not trying to push you to one insurance company over the other. We're really just here to give you as much information as possible, or especially now during the open enrollment period that goes until December 7th, we can help you compare the plans that are available to you, and we would show you every single plan. So like I said, we're not trying to push one insurance company over the other. So if you need help comparing the plans, especially since they do change from year to year, and I think I've started to notice with a lot of other people is that especially things like your drug plan, there are some significant changes to prices, how they cover the medications. So we'll go over some of that in the updates section. And so I do also like to cover just some basics. Is anyone going to be new to Medicare or doesn't yet have Medicare? No? Okay, so maybe I'll go through some of these pretty quickly just so you have maybe a quick refresher on how Medicare works. So the Medicare eligibility. So in general, you have to be a U.S. citizen or a permanent resident to qualify for Medicare. For most people, you have to be over the age of 65, but it is possible for people under 65 if they have a disability, or essentially if Social Security says they meet the requirements or they are approved for Social Security disability. In that case, they do have to wait a total of 24 months or 2 years to qualify for Medicare, but after those 2 years, they can be enrolled in Medicare. There are also certain diagnoses where if someone has end-stage renal disease or ALS, they can't instantly qualify for Medicare. And then also it is possible for if one spouse didn't work for at least 10 years in order to qualify for for Medicare to be free, you can actually qualify through your spouse's work history. And then there are various enrollment periods with Medicare. Definitely if you're new to Medicare or if you know anyone, that is the initial enrollment period. So you have a total of about 7 months to enroll in Medicare and to set up your coverage with your Part D plan or your supplements. And that starts the month of your birthday, 3 months before, and 3 months after. That's where you get that 7 months. There is also a general enrollment period that goes from January 1st to the end of March. This is more so if anyone either delayed enrollment in Medicare in Part A or Part B, this is when you would be able to sign up for Part A and Part B. There is the annual open enrollment period that's going on now. Every year, that's October 15th to December 7th. For those of you that have a Medicare Advantage plan, or if you do have one as of January 1st, you actually do have another open enrollment period from January 1st to the end of March. So especially if maybe you're trying it for the first time, but you do want to switch back to original Medicare, maybe switch to a different plan, you can actually do that at the start of the year for the first 3 months. And then there are various special enrollment periods. So if you ever have some type of major life change, like maybe you move to a different county even, or different state, or if you have a loss of insurance, usually that means you qualify for a special enrollment period where then you can sign up or make other changes. And then again, you may know this about Medicare already, but there are some penalties with Medicare if you don't sign up, usually when you're supposed to, or if you don't have other coverage. So in general, for Part A and Part B, there is a 10% penalty for every 12 months that you don't have coverage, but they have different time periods that they last. So the enrollment period for Part A, it lasts for twice as long as the number of years you didn't have coverage. So just for example, if you went 2 years without Part A, they would charge you this penalty for 4 years. The penalty for Part B, unfortunately, that does last for the rest of your life, where it would be 10% for every year. There is also a penalty for Part D. This one is 1% for every month that you don't have coverage, and it also is a lifetime penalty. And then as far as the cost, so unfortunately I don't have yet, or they haven't announced the cost for Part A, and mainly that's the deductible. Because for most people, your Part A is free, but for 2024, the deductible was about $1,600. It is expected to go up a little bit, but we don't know exactly how much yet. And the other key thing to know here is that this is a deductible you pay if you don't have a supplement. So if you don't have a supplemental plan, you would have to pay this deductible, and sometimes it's every time you go into the hospital. But if you do have a supplement, usually they all do cover this $1,600, so you don't have to worry about that. But just so you see some of the numbers, if you don't have a supplement, if you have a very long stay in the hospital, it is pretty expensive, where they could charge you over $400 per day, or even $800 per day. That's pretty rare. It's not likely you would ever be in the hospital that long. But I have seen that happen, where sometimes people are in the hospital a month or two. So without that extra coverage, even Medicare can be pretty expensive. So in general, what Medicare covers is when you're an inpatient in the hospital. So that's very important to remember. So sometimes maybe the hospital or doctor will say you're admitted to the hospital, but that doesn't really tell you the full story. It really depends on whether you're considered an inpatient or if you're under observation status. So if you are an inpatient, that is covered by Part A. A couple other things that usually is covered by Part A are if you ever have to go to a skilled nursing facility for rehab or physical therapy, then that would be covered by Part A. Or say if you actually instead need home health, physical therapy at home, that would also be covered under Part A when you're an inpatient. And then for Part B, this one also, they haven't announced the monthly premium for Part B yet, so I'm sure you know it's about $174 currently. It is anticipated to go up. They haven't told us yet exactly how much. But also the deductible, that should go up. More than likely it'll be about $20 or $30 extra in 2025. But Part B is your medical insurance, so essentially everything other than inpatient care in a hospital, that'll all be covered under Part B. So you see that includes things like your doctor visits, outpatient hospital services, home health, or durable medical equipment, like if you ever need a wheelchair, a walker, or even a hospital bed, that would fall under your Part B. And then Part D, that is the prescription drug plan. So if you have original Medicare, usually you have a separate plan to cover your medications. So these numbers are current. So for 2025, the drug premiums are pretty, they vary widely. So there is actually one plan that has a zero monthly premium, but the most expensive one is $125 per month. And also the deductible did go up. I believe it was $560 or $70 this year. It's going up to $590. One thing I'll quickly say about the deductible is that it doesn't necessarily help you to compare the plans based on the deductible, because some of the plans, if you take mainly generic medications, they will give you the discounted price right away. You won't have to pay up to the $590 compared to some of the more specialty or brand name drugs. So that's why it's there could be, if you take mainly generics, more than likely even those lower cost plans do cover you better. And then also it's more so better to shop for the plans based on how they cover your medications. So yes, the monthly premium and the deductible are important, but you'll definitely want to look at the plans according to how they cover your drugs. Yeah, if you have a question.
Is this part of the, I heard it's going to be $2,000 out of pocket for the year. Is
Yes.
this part of that, or is this separate?
Yeah, so it is still, that was actually the next part is, so definitely the biggest change for next year when it comes to your drug costs is that there is now going to be a $2,000 cap on how much you pay out of pocket for your medications. This doesn't include the monthly premium, so that part is separate, but everything you pay to the pharmacy for your medications, the most they'll be able to charge you is the $2,000. Yes.
Okay, that's only if your plan covers that drug, otherwise it doesn't apply, right?
Yes, so I was going to say that too. So
And Good RX isn't, if you use Good RX,
that's separate.
It doesn't include it anyway.
Right. So she was asking in case it doesn't include if your plan doesn't cover your drugs. So that's why I say you really have to shop for the plans by the drugs you cover, because you want to make sure that the drugs you have or take are on the list of drugs that they cover. Because if it isn't, you're going to pay just the full price for the entire year. And usually that could easily be thousands of dollars, depending on the medications you take. Because the other big thing is, this also applies if you have a Medicare Advantage plan, it's the same limit for the medications. But for those plans, they usually have also a maximum for the health benefits of what they can charge you, but it is separate. So there'll be a maximum for health benefits and a max for medications. And then the other big thing or important thing you can do is that if you do have very expensive medications that you have to refill more towards the beginning of the year, you will also have the option to spread out those payments through a type of a payment plan that you can sign up for. It is a little complicated with how they set this up, or how you have the option to have this payment plan. So what you have to do is you have to contact your Part D or your insurance company to say that you want to have that option or to enroll in the option to have the payment plan. Because once you do that, the next time you go to the pharmacy, if you have more expensive medications, I believe the cutoff is about $400 or $500, where then they'll offer you to spread out those payments for the remaining months of the year. So it's probably the most helpful during the beginning of the year, or maybe towards at least the first 6 months of the year. So that way those payments are more so spread out over the 12 months or however many months are left over in the year. Because I have started to see, as I've helped people, there will still be some expensive medications where it might cost $500 or $600 to refill the very first time in that year. So instead of having to pay that lump sum, you would pay maybe $50 or a little bit less per month for the rest of the year. But instead of paying the pharmacy, that's the other big thing. If you sign up for the payment plan, the pharmacy will ask you if you want to have those spread out payments. But instead of paying the pharmacy, your Part D plan or your insurance company, they're actually going to bill you for those medications instead. So that'll be something different. If you usually, most of the time we're paying for medications at the pharmacy, but if you're using the payment plan, you're instead going to pay your actual insurance company. Okay. So any questions? I know this was they've unfortunately made it a little bit, there's some extra steps you have to take here, but it's definitely one of the biggest changes and I think benefits to you that there will finally be this $2,000 cap. Because for example, this year or in 2024, the cap was $8,000. And before that, there was no limits to how much they can charge you. Okay. And something you may already know if you take certain types of insulin, this amount is still capped at about $35 per month for insulin. There will be still some types of insulin that isn't capped at $35. It really just depends on the kind that you take. But your plan should tell you if they're either changing the types of insulin that they cover, or if it is more than this $35 max. And then something else that was expanded actually last year is that there is a program where if you have, if you meet certain income and asset limits, so usually if it's a little bit lower, then you can qualify for this program. It's called LIS, or a lot of times it's called Extra Help, where when you qualify, you'll have access to plans that cost $0 per month, or they'll discount a lot of the Part D plans. And then most of your medications will either be free, or I believe the most they could charge you for more brand name or specialty drugs is about $10. So it's somewhere between $4 and $10 that you get a discount on when you qualify for this Extra Help program. If you're interested in finding out how much these limits are, or if you want to see if you qualify, just feel free to give us a call, and we can always just quickly run you through those numbers of how you qualify. But even if, I would say, even if you think you don't qualify, if you have high medical expenses, that actually helps you qualify for this program. So even if you think you have higher income, or if you just do have higher income, there's actually a few different ways that you can qualify for this program. Yes?
Back to the insulin.
Mm-hmm.
What, does it cover have any kind of caps or anything on non-insulin diabetic medicines?
So I don't believe so, because I know there are still some insulin or non-insulin based medications that diabetics have to take, where it's still pretty high. Actually, it may be more so with this that I was going to kind of get to. There are some of those types of medications where starting next year, or not next year, starting in 2026, Medicare was able to now finally negotiate drug prices directly with the drug manufacturers to get lower prices. These are the first 10 that they selected to be to have these negotiations. I believe Januvia is one of those diabetes drugs. Farxiga, I think, is also another one. And Jardiance, yes. And from what I've seen, they did also announce the prices. Most of them will be more than 50% off compared to what they're charging now. The hard part is these prices won't take effect until 2026. I know the other is Eliquis. I know that a lot of people take that. That's I think it's currently about $500. It's going to drop to about $200 in a couple years. Xarelto, I know, is another one I looked up. I know it's currently about $517. In 2026, it'll be about $197.
That's per month?
Per month, yep. Mm-hmm. But then it'll be per month until you get to the cap.
26.
It's starting in 2026. But then after that, every year, Medicare will be able to negotiate even more drugs with the manufacturers. It's just that it is a whole another year wait before we see some of these prices. And this also started in 2023, but if you Medicare does cover now more vaccines at 100% of the cost. I think the big one is definitely the shingles vaccine, since it's so expensive. I know it's over $200 per shot, and you need 2 of them. But Medicare now does cover that 100%. So if you were either, I would say, holding off on vaccines because they were too expensive, just check with your doctors or check with your pharmacy, because more than likely, most of those vaccines should be free for you now. And so as far as the drug plans, so since these change every year, there are actually less plans, because one of the insurance companies actually dropped out of the Part D plans. That was Mutual of Omaha. So if anyone did have one of their Part D plans, you should have been notified that they're not offering plans for 2025. So that's where you'll definitely want to compare your options to see how the other plans will cover you. Because instead of, so this year there were about 22 plans, next year there's only 15 to choose from. And if you'd rather do this on your own, or if you like doing your own research into these plans, you can do that pretty easily or somewhat easily on the Medicare website. It's just medicare.gov. They have a tool there where you can enter all of your medications. You can pick the pharmacy that you like going to, and then it'll show you all 15 plans. It'll show you all the plans that are available to you, and it'll give you a really accurate estimate of what those costs will be. I know there's a lot there, or sometimes it can be a little difficult to navigate the website, but that's where we can come in, or if you just need help reviewing the plans, or you just want to make sure that you're understanding it, you can always call us and we can always go through that with you together. Yes.
Is it that the minimum payment has gone up for 2025?
You mean, has the minimum payment gone up for the Part D plans?
Yeah, for drug plans?
So I've seen it both, where if you have a current plan that's still going to be available for next year, some of them have gone up quite a bit in price, sometimes even double. Right, I know there's at least one plan that was about 20.
Paying way lower.
Yes.
There's going to be a minimum.
Right, it's a lot of plans have increased pretty significantly in price. There were a few that actually went down, so it just depends on how your plan is set up, or what the insurance company set for next year.
Okay.
More than likely they're doing that because of the $2,000 cap, but that's why I think it's easier. It's pretty good to compare your drug plan every year, because there just could be a different plan that covers you better, or saves you quite a bit of money. Because there's no penalty to switching your drug plan every year. There's nothing to keep you from doing that. So it's always good just to make sure that you still have the plan that works best for you. Did you have a question, or?
Oh, his went up 4 times the premium.
4 times? Okay.
Mine went down $2. His
Yeah.
went up 4 times. So
Yeah.
he'll be changed.
Yeah, I would say at least check, because it might end up that it's still the one that saves you the most money, but it doesn't take too long to compare the options.
Mine went down to 0 last year.
Did it? Right, so there is still that plan.
This year.
Okay, I
Yeah.
already did.
Yeah, because in 20,
Somebody told me that's good.
Yeah.
If you have generic drugs.
yeah, right, because it was a little different where this year in 2024 there was a plan that was 0 per month. It was through WellCare. Yeah, they're offering that again next year, but usually that's more so if you take mainly generic medications, or less when medications are at a higher tier. Usually that's when you need a more expensive plan. But if they're all in the lower tiers, yes, you can sign up and be really well covered by that WellCare plan, or by some of the other low-cost plans. Or even, like, I know someone mentioned the GoodRx program. If you're not using that, that's actually, sometimes they do give sometimes better prices than what you get with your plan. Even some new online pharmacies have started to pop up where they do offer even lower prices than your drug plan. Or another thing is, the other good reason to use the Medicare website is that you can check other pharmacies and check their prices. Because I've started to see that more, where sometimes if it's especially with more specialty or expensive medications, sometimes it'll be a different pharmacy that covers just that one medication a whole lot better than every other pharmacy. And you can go to different pharmacies, so you don't have to pick up all of your drugs at one pharmacy, even if it's just one. They just have to send the prescription to that pharmacy.
So you can have 2 pharmacies?
Yes, right. Yeah, and that's why it's hard to do that without, say, calling the pharmacies, or it would be hard to do that calling the pharmacies, but if you do it on the website, it'll show you can pick a total of 4 pharmacies, and it'll show you all of those prices. Okay. And then for those of you that have Medicare Advantage plans, there are a total of 63 different Medicare Advantage plans. I would say that both can be a good thing, but also a bad thing, just because there's so much choice. It can be very complicated, especially since because of the way they work. Sometimes they have other benefits that you either might need or don't need. So just know you do have a lot of choice if you're already in the Medicare Advantage plan. There, I would say it's a little bit more difficult to change those plans, just because you usually have to go to the in-network providers. But I did want to talk about those in case just so you get more straight information about that. Yeah, but before that, I just wanted to mention this. I think I might have mentioned this last year, but Medicare does now have more rules as far as how insurance companies can advertise their plans or their services to you. So they're supposed to be less deceiving, or at least more clear about what they're actually trying to sell you or what they're trying to offer. But especially things like insurance brokers or insurance agents calling you, you can't opt out of those calls, and they're supposed to stop calling you. Because now Medicare requires that they keep accurate call logs of how often they call people. If they're having seminars like this and they're actually not allowed to call you back right away or during a certain time period. So there's a lot of rules that they have to follow. But I guess maybe just the easiest way to see it is that if you're getting a lot of calls from insurance agents or brokers, tell them to stop if you don't want those calls, and then they're supposed to follow that, or they're supposed to listen to you and not keep bothering you, because Medicare does have some rules and penalties that they can impose on those insurance agents. And then so I like talking about the Medicare Advantage plans, but just so you know exactly how they work, because I know that some people just really like them, some people they don't want to consider them, but especially because of the advertising, because it can be so confusing about how they work. I like just to tell you exactly how they work and how they could cover you, just so you can understand if they are even an option for you. So these plans, they more so work like private insurance, or the insurance you had through your employer, where they'll have different types of plans, where there are HMOs, there are PPOs. They also have they're called private fee-for-service plans, and also even they're called special needs plans. And those, again, they work just like your private insurance that you used to have. So an HMO, you might remember, you have to go to doctors that accept that plan, and you need referrals if you have to go to a specialist. Otherwise, they won't cover you if you go out of network, or if you don't have that referral. It is still similar with PPOs. So even though you have the option to go out of network, you still want to go to in-network providers, because otherwise they're going to charge you a lot more. Usually they only cover about 50% when you go out of network with a PPO. Private fee-for-service plans, these are pretty rare. Sometimes there's only one of these available in your county. I can't remember if there is one in Will County, but the way that these work is that the doctor has to accept the plan, but they also have to accept the rates that they're paying. So it's a little confusing with how these work, but just know these are pretty rare. But just keep an eye out if you're shopping for these plans. The special needs plans, these are usually mainly for people that have a certain medical diagnosis. So if you have cancer, diabetes, or kidney disease, they have these special needs plans that offer extra services that usually Medicare doesn't offer. But I would say one thing to know there is, more than likely you've seen commercials where they offer you grocery benefits or maybe money back from your Medicare premiums. Those are only from these special needs plans. So the key thing there is, if you don't qualify for the special needs plans, you also won't qualify for those extra benefits, or even have the option to sign up for those plans. I know one of the commercials I just recently saw, they seem like they are trying to define it a little bit more. It still seemed a little confusing to me, but they're starting to talk about the special needs plans a little bit more, because that's how they can market the grocery benefits or those extra benefits that they're trying to sell you. Okay. And so I know this, since there are so many different things to consider with these, sometimes the cost can be very different compared to original Medicare. So for the Advantage plans, you do still have to pay for Part B. That's at $174 or so. But the reason that some of them say that they're free is because they don't charge you an extra amount per month for those plans. So there will be some Advantage plans that have a 0 monthly premium, but that just means they won't charge you an extra amount. And then usually these Advantage plans do include your drug coverage. But they'll also have either health deductibles or deductibles for your drug coverage. Some of them will be zero. It really just depends on the plan that you choose. And then for just about everything else, so your doctor visits, hospital visits, test procedures, they'll either be copays or co-insurance. Co-insurance is just a percentage that you pay of however much that service costs. But probably the key thing, like I mentioned earlier, is that these plans do set an out-of-pocket maximum of how much they can charge you for medical benefits. So once you reach that limit, then the plan will pay 100% of the cost. And then I kind of mentioned this already. So you do have to, usually you have to stay in network to get the lowest cost, because if you go out of network, either the plan won't cover you or it'll be pretty expensive if you go out of network. And then of course, usually what they tell you about the Advantage plans is that they do have those extra benefits. So most of them do include things like dental, vision coverage if you need glasses or contacts. They do offer gym memberships or transportation benefits. They can offer those things in addition to what they normally offer, but just keep in mind that it has to be through providers that work with that insurance company in order to get those benefits. So just keep that in mind too. And so usually the most common question I get is which one is better. But since we're part of this program, and we still, we're not going to tell you what to sign up for. We're not going to tell you which one is better because I think it's just different for everyone. And so I think that really the best way is to look at how much it'll cost you for the entire year, especially since they have those caps. And because sometimes for some people, maybe if you are healthier and you don't have to go to the doctor that often, but you do want at least that comfort of knowing there's only so much they can charge you, then yes, you probably would save some money with the Medicare Advantage plan. But if you need to see any doctor you like, or you don't have to work within the network, then you'll definitely want to stay with Original Medicare. So usually when people ask me that question, I go over more so this comparison of how much you'll pay with the Medicare supplements compared to what you could pay with the Medicare Advantage plan. So for example, if you remember, those Advantage plans, they have an out-of-pocket limits, and the lowest that I saw for next year is just a little over $2,300. But then on the other side of that is if you have a Medicare supplement plan, at least if you're 65, more than likely you'll pay about $1,700 for the year, and that will really cover most or just about all of your healthcare needs. So all your doctor visits, hospital visits, that would be covered by this type of Medicare supplement that costs more so in this range. So in that case, if you look at someone, if in the worst case scenario, if they need that much health care, in this case, that person would actually save a few $100s having an Original Medicare with a Medicare supplement plan. Of course, you also want to factor in if someone needs or wants those extra benefits, that definitely adds some value there. But I think this is really maybe just a good place to start, is look at just the total amounts that you could have to spend in a year for all of your medical bills. And then from there, you can decide which way works better. I guess something else you can consider is if you ever do spend time out of state or in other areas, or if you have to travel to other counties for a specialist or any of your other doctor visits, even with a Medicare Advantage plan, even though generally in our areas there are a good number of providers, but you may run into issues there if they're part of a different medical network, or if it's outside of your county. Sometimes there it can be difficult to see some of those specialists or some of those other doctors. And I just want to quickly mention some of the other benefits, like I mentioned in the beginning, that we try to offer through AgeGuide. So one of the handouts I left you actually lists a lot of those services. So those transportation benefits, the financial assistance, and the phone numbers that you would call to access some of those services. But one thing I'll mention, so the nice thing about those other services we offer, there aren't any financial requirements to qualify. We don't use insurance to provide those services. Or so they're available to just about anyone, regardless of your income. So if you ever do need anything else, there's a really good list there to refer to if you ever need any other type of assistance. Like for example, one way you can use this is through the financial assistance. If you ever need help with some of your medical costs that aren't covered by your insurance plan, sometimes we can actually help you with that. Or even it can be used on things like car repairs, home repairs. It's pretty flexible with how you can use that. But like I said, it's available to anyone, regardless of income. Also caregiver programs, because that's the big thing that Medicare doesn't cover, is if you ever need help at home. There's very rare cases where Medicare does cover something like a caregiver that'll help you with your household needs, like cooking, cleaning, or helping with your personal care. But there are other state-based programs where you can have a caregiver for a certain number of hours every week, whether it's temporary or even for long-term. So if you ever have questions about things like caregiver services or programs, feel free to check with us, and we can always help you either apply for those programs or see how you qualify. Okay. So, did anyone have any questions?
TRIAD works to improve the quality of life for seniors by providing an opportunity for the exchange of information between public safety, social services, and seniors. There are no membership papers to fill out or fees to pay. Everyone is welcome to attend. Each month, we present a guest speaker on subjects that keep you informed and up to date on the latest scams, frauds, and other criminal activities. We also discuss safety issues, home preparedness, and staying healthy. TRIAD meets the fourth Thursday of every month. Contact the New Lenox Police Department at 815-462-6100 for more information.